My name is Maria de Rosario Valdespino Mejia. I am master student in Ciatec in CDC, and I am willing to tell you a bit about my work in silent development in characterization of calcium polymer silicophosphate composites candidates for the manufacture of diabetic dressings. According to the World Health Organization, there are about 122 million people worldwide with diabetes, where from 12 people, at least one person has it. Diabetes is a chronic degenerative disease that can trigger different complications in the bodies of people who suffer from it, among which we can find peripheral neuropathy, which affect the feed sensitivity, triggering diabetic foot ulcers. It's estimated that at least 68% of people with diabetes develop ulcers. Currently, the treatments used to treat diabetic foot ulcer consist of patches that are intended to improve and shorten the healing time of this condition. But these treatments are costly, non-functional, and size limited. In this sense, material science and engineering have the ability of the development and new treatments of these injuries, such as wound dressing from biopolymers by altering particles that promote a functionality that helps the treatment and carry of wounds. Therefore, the aim of this work was developing composite dressing from biopolymers such as methyl cellulose and polyvinyl alcohol. These biopolymers have properties such as biocompatibility, absorbability, degradability, and good mechanical properties that made them ideal for the development of dressing. Also, the formulation of composite dressing was developed by adding Nagel particles to the polymeric matrix, which are calcium silicophosphate that has been shown to stimulate mechanisms that can improve the wound regeneration process, such as angiogenesis, collagen synthesis, and cell proliferation. The first step of this research involved the synthesis of Nagel powders, which were fabricated following the methodology of our research group, which consists a mixture of hydroxyapatite and bioactive glass as the precursor powder using a high-energy mechanical milling. Then a sintering process is performed where the phase obtained after the sintering, a post-milling process is carried out to homogenize the particle size. Finally, the powder is sieved to obtain a particle size below 53 microns. The powder obtained is structurally characterized by X-ray diffraction and laser diffraction to determine the particle size. For the preparation of the polymer membranes, solution of PBA-MC and PBA-NC with and without glycerol and agar particles were fabricated. Subsequently, the membranes were manufactured by the plate casting method, and the drying and shaping was studied by two methods: convection knowing and freeze-thaw cycle drying. where a physical cross-linking is induced to stabilize the matrix and obtain the polymer membrane. The fabricated membranes were characterized by XRD and SIM to determine the dispersion and presence of the ceramic particles in the polymeric matrix. Subsequently, a degradation test was carried out to determine the stability of membranes in terms of mass loss after 5 days. In the same time, the absorption capacity of membranes after the degradation test, it was found the methyl cellulose membranes with glycerol with and without ceramic particles were completely degraded, so they were no longer considered for the following tests. Finally, in order to know the capacity of membranes to trigger biological mechanisms, a bioactive test was carried out at 6 and 10 days. Subsequently, the mechanical properties of the polyvinyl alcohol membranes with glycerol and polyvinyl alcohol with methyl cellulose with and without Nagel particles were evaluated by monitoring to the maximum stress, the percentage of elongation, and Jones modulus. Results show that most of Nagel powder particles have a particle size of 18 microns with a distribution from 1 microns to 34 microns. This is a favorable result since particle planes in the polymer matrices are reported to be smaller than 45 microns. The method of improve the formation of flat homogeneous membranes was the physical cross-linking method by freeze-thaw cycles, since the conventional drying method promotes the entry of air in the polymer matrix and leads to rapid solvent elimination, causing defect and malformation in the membranes, which is not desirable for the application as resin of this type of membranes. Thanks to the XRD characterization of the membranes, the presence of peaks corresponding to the Nagel particles was found, and by SIM, it was possible to confirm the presence of particles in the polymer matrices with a distribution throughout in the membranes. The degradation tests showed the methyl cellulose membranes were not suitable to be used as resin as they degraded complementary after 5 days. However, PBA, LG, and PBA MC membranes with and without Nagel particles showed an absorption percentage above 50%, indicating the ability of these membranes to absorb exudates. Mechanical tests show that the polyvinyl alcohol membranes with glycerol with and without Nagel particles have very mechanical properties, special elongation above 100%, which call for the placement of the resin as they are flexible and can be adapted to different wound areas. The bioactivity test shows that the membranes are able to prove the biomineralization mechanisms. In conclusion, we were able to manufacture polymeric membranes with very good mechanical and bioactive performance, as well as the ability to absorb exudates. We showed the potential of these membranes to be used as wound healing dressing. In the following steps of the research, we will continue with the development of in vitro and in vivo tests to determine the performance of these membranes and a biological level in the participation of the tissue regeneration mechanisms. Finally, I want to thank CONACYT for the opportunity of the master scholarship that allowed me to carry out this research. I also want to thank the team of the project, Technological Scaling Bioceramic to Induce Bone Regeneration, and Won Haley for the funding.